Both of you are very low.
Check your volume on your. You might have to
I
max
I
out your volume.
did. I
That's
did.
what I
It's
have to
turned
do.
up pretty high. I can still hear you, but
Can you use earbuds? Would that make a difference?
I have
Oh, you
earbuds.
have
Yeah.
them in. Okay.
Yeah.
And Kelly's still low.
Interesting. Yeah, you're both really low.
Hmm.
I wonder
We
why.
and we speak very loudly, both of us. It's just
I'm
loud.
I'm pretty sure. I'm pretty sure something within this here. I think I
But
can
can
still
you
hear
hear
you guys.
us?
Yeah, I can hear you.
Okay, I'll just
Okay,
talk a little bit
awesome.
louder.
Yeah.
What? Don't do that. You're gonna blow my ear. No, no, no. No, I'm just kidding.
All right,
Well,
kick it off,
welcome,
Donnie.
welcome, welcome. Um, Thank you so much for honoring us with your time. Definitely. Kelly told me about who you were in the hospital, a nurse, and you stopped her, and I think she probably was taken back because as you know, sleep is usually not really in the hospital first and foremost, and then it's not really respected, which we could tell by the recovery time of our patients. So just knowing that you pulled her off to the side to just have a conversation with her made such a great impression. And she was like, "Yes, come on." So that's why you're here because and we wanted to hear about your journey too when it came to sleep. She said something about that. She said he may share, he may not share. So that's all I'm going to say. But thank you so much for honoring us with your time. We are looking forward to hearing about all that you're doing, and also you actually, I call it forward thinking, understanding the importance of sleep and how it affects your patients. And we just want to just try to help every nurse, every medical professional understand how important that is. So thank you so much. And now let Kelly do her thing.
Okay.
Hey, Ishmael, thank you so much again for coming on the podcast. I'm very excited to have you. I think it's going to be awesome to have a nursing perspective about sleep and how we work together. And you have your own story. So, just for the audience to know a little backstory, Ishmael had he's an RN in the IMCU, and he had a patient that I was speaking with that screened high, but Ishmael was in the room, and he was listening. And after I got done with the patient, we walked out together, and he was asking me some questions. So we talked for a while. And then ever since then, whenever we see each other, we're always still talking about different things in sleep because he's always reading on something that's I don't even know about half the time. He's like,
Yeah.
"Did you read this book? Did you read this book?" So I'm very excited to have a nursing perspective. And thank you for coming on again. And go ahead and let the audience know a little bit about your background and if you want to share any of your sleep journey or your dad's sleep journey, and then the whole sleep part with your patients on the hospital.
Yeah. Well, thank you so much both for having me. And very first time I ever do a podcast, so I'm sorry if my manners is not podcast appropriate, but I'll do my best. So yeah, it was an incredible pleasure to listen to Kelly speaking to the patients, and I've seen Kelly a couple of times in and out. I also just wonder what was her role. It's like a bunch of people coming in and out of our rooms and our patients, and I happened to catch her, explaining to the patients, um, the importance of good sleep and what this person needed to do in particular, which I don't remember the details, but I do remember thinking, wow, I think what she is talking about is very important. And so I think you spoke to me more about, sleep apnea, which I wasn't then. I wasn't um, as informed as I am now. So a little bit of my journey with sleep was in my late, I'm 42 now, so in my late 30s, I started having issues where I would wake up in the middle of the night, kind of gasping for air, or with my chest thumping, or my head thumping, and really, really warm, I guess as if I was doing some sort of physical activity. And it was in the middle of the night, and slowly I realized I think I'm having sleep apnea at nighttime. But this was way before I had met Kelly, listened to Kelly. And back then I came across, I started digging what's going on here. But I really didn't take much interest on it, to be brutally honest. It was just like a a side thing at first. And I think most people, the exact same thing happened to my father when I started talking to him about sleep apnea. Most people don't initially think of it in the seriousness that it needs to have. So, nonetheless, this book came across called Breath by James Nestor, The Science of Breathing or the Lost Art of Breathing, something like that. And wow, it blew me away. It absolutely blew me away. All the information that was in there. This book related to a Irish physician. I want to say his name is Stephen McKeon. McKeon. He's got another incredible YouTube channel that speaks a lot about the issues with sleep apnea and how they're connected to ongoing health, because he's a physician, to other health issues, mainly with allergies, respiratory problems, but then ultimately what Kelly's aware that she educates patients on, which is it can ultimately lead, severe cases can lead to heart failure and strokes and heart attacks and things that happen in the middle of the night when people are sleeping. So all of this information started piling up in my head, and I, even though I'm relatively young still for sleep apnea, you would think I wasn't. There are people as young as their teens, even little children who have sleep apnea and need some sort of machine at nighttime, a CPAP machine to help them breathe correctly while they're resting. And I got a hold of one of these devices and I started using it at nighttime, and wow, the transformation was tremendous. That tiredness at around 2 in the afternoon when you're going for that second round of coffee just was no longer there. And the I was having headaches. That also was no longer there. And most of all, I was not waking up in the middle of the night in that um, physically active state that I would almost like a panic that I would wake up in. And that then led me to more conversations with Kelly every time I saw her because I was so excited. I just discovered this incredible thing for my life, and it made such a great impact. It almost felt like some of the lowest hanging fruit that you could do for your own health. It's even more important than good exercise. It's even more important than good nutrition. It's good sleep is number one. Like it overshadows anything you could do, any exercise routines, any magical pills that you take, any potions that you think you're taking that is going to make you a superhuman. Nothing beats sleep. It's just 100% that way. And then my father, so I went, this was probably my late 30s. This is fortunately a very recent journey for me. I went a couple of years using my CPAP religiously at nighttime and just restoring my health and just feeling so much better. I started losing weight, started feeling more energy for exercising. My brain, that brain fog was pretty much gone. And that was a big problem for me. Well, my father starts complaining maybe a year and a half ago.
Who's he?
He's down in Florida. He starts complaining. We would
What is his
chat.
age? What is his
He
age? How old
is
is
he's early 70s.
early 7? Okay. Okay.
Yeah. And he starts to complain of a dry mouth at nighttime, and his main symptom was losing his voice at the end of the day. And at first it did not click in my head. It didn't it didn't readily register at first. But then after several conversations, I asked my father, well, how are you sleeping at nighttime? Because he tells me another issue with sleep apnea, which is nocturia. He tells me that he gets up like 4 or 5 times to go pee in the middle of the night. And right away, like the light bulb went off in my head, and I said, Dad, you probably are having um, sleep apnea issues. You're waking up with a dry mouth. You sleep with a cup of water at your bedside because you wake up with very dry mouth, and then you wake up 4 or 5 times to go to the bathroom every night, even though you don't drink water before going to bed. And then you're having this allergies and voice issues at the end of the day. He's a realtor, so he does a lot of talking on the phone. And it was becoming so debilitating for him that he could not finish talking to his clients any later than like 2 in the afternoon. He would just pretty much lose his voice. It would be very difficult for me to communicate with him. My mom was very worried about what was happening to my father because it kind of came out of nowhere, this issue with his voice. Um, and I pestered him and pestered him and pestered him to get a sleep study. Well, he got so tired of the other symptoms that he finally decided to go ahead and get checked out. And surely enough, he did a sleep study and he didn't pass it. He failed miserably. So he was told that he needed a sleep apnea. And this has been also a transformation for my father because he got his his sleep apnea machine. He got all set up. I told him at first he had the big mask covering his mouth, and that was not comfortable. Right? I'm like, man, you got to get the nasal pillows. Those are just the most comfortable. He got the nasal pillows, and then the guy is just like, I'm telling all my friends about this because this is just the greatest thing ever. Yeah. So that's pretty much it in a nutshell.
Awesome. And he did it in his 70s.
Yeah. And he is feeling great. He's feeling great. He thanks me all the time. He talks about it all the time, about just how good it has been for his life.
Awesome. That's good. I love it. Go
I
ahead,
love
Kelly,
it.
my girl.
I love it because Ishmael just described exactly most of our patients, and you did it in such a way. You kept after him, and you knew all the symptoms. Because if I remember right, when we were in the room together, when we left the room, because it was several years ago, because we've been at the hospital for 5 years now. He said, I was standing there and I was saying yes, yes. He was answering the questions for himself. So he already knows. And I just love how Donnie always talks about this. Not only are we educating the patient, we educate any family in the room and the nursing or any other staff in the room that's listening. And then because you're a nurse, you have that medical knowledge and how important it is and how it affects overall health. You have that brain power and connection. Then you go out and you got your dad, and now his dad got others. So one little interaction spreads the word everywhere and helps improve everyone's health because unfortunately not everyone thinks about sleep. Because honestly, if you could see all of Ishmael, he has lost weight, but he doesn't necessarily fit a sleep apnea.
Hmm. Yeah.
Everyone assumes that we all have to be very, very overweight. And that's not always true. It can be the neck up. And most
Yep.
men have big necks.
Yep. Yep. Well,
Yes.
I actually would like to add a little tidbit. I have been a cardiac nurse, as well as a neuro nurse, and so in both of those fields, you get the stories of what happened before, before the patient get there. And if you're paying attention, as a detective, so to speak, if you're listening to what they're telling you, you hear the story of sleep apnea in the background, with both heart attacks in the middle of the night, or just very early in the morning waking up, and strokes in the middle of the night. They went to sleep just fine, and then they woke up not well. So this is um, a huge. I think I told Kelly something along the lines. It is an epidemic uh, that nobody talks about or cares or is aware of, this issue with sleep apnea and just the horrible deleterious effects that it has on the body outside of just good quality sleep, which is just, I mean, you cannot pay enough for good quality sleep. Um, Imagine having the kind of, you know, strokes that we see in my floor now. I mean, I would do anything and everything that I could do to protect my brain while I sleep so that I don't wake up and I can no longer eat or drink water or being able to hear or speak or move my body. Or all of a sudden now I can't use the right side of my face and I'm choking on food, or I can't no longer go to the bathroom independently because I have no control, or I can't even get to the toilet. So these things, if you kind of trace them back, if like kind of almost like an electrical engineer figuring out where the circuit short is, if you trace it all the way back, I think I'm not a physician obviously, but I really think it's related to sleep apnea, and I hope that Americans wake up to this issue, and then that healthcare follows and does the necessary things, the necessary interventions, the education, which I think Kelly's doing already. But I think that there needs to be a lot more awareness about this issue, for sure.
And the issue with the awareness is that because a lot of the physicians and even other medical professionals are not educated enough to even speak on it, so they don't speak about it. So sometimes we're the only people they hear it from. And that's why people like you, Ismail, and the people that we affect at our hospitals, that's why it's so important that you guys continue to do what you do when you know you see it, you recognize it, and you speak it out loud to the patients so they'll know, okay, this is not the only time. You know what? Mrs. Donnie just told me this, oh my God, I got a nurse. Now I got a doctor telling me this is real. And I think that's one of the issues. We don't have enough people talking about it. And then a lot of times when we talk to our patients, it's the first time they've ever heard it. Or I'll say this, they'll tell me, if someone would have said it like you did, I would be wearing my CPAP, because they don't come down to their level to have them understand that it's connected to their congestive heart failure, their hypertension, or diabetes, and their obesity, and it's all tied into your sleep. And if you try to, no, not try, if you control that, then things will change. And the other thing is, so many people are used to sleeping lousy. I tell my patients all the time, I said, you don't even know what good sleep is. I said, lousy is normal for you
Yeah,
because that's what you've been functioning on for all these years. So thank
that
you
was my
again
story.
for,
That was my father's story. Yeah, you're right.
was it? Yep.
Yep.
How, forever, right? As long as you've been alive,
Yeah,
he's like,
probably.
mm-hmm,
Yep.
yeah. Go ahead, Kelly girl.
And then we ran into each other again recently, and that's when I said he's got to be on the podcast because he was talking about sleep for his
Oh,
patients, or
say
all
it
of our
again, Kelly.
patients in the hospital,
Kelly, say it
all of
again.
our
You
patients.
froze.
Oh,
Oh, you're good. You're
uh,
back now.
okay. So we had this conversation, and that's why I was like, he really needs to be in this podcast. And he stopped me and he was talking about the importance of sleep navigation in the hospital and how the sleep is so important when you're ill that you get some type of good rest in the hospital, because all three of us know if you don't sleep well, our body does not heal well. Now, granted, IMCU and ICU is a little different because they're more unstable and you may have to go into the room more often. But I would think, and Ishmael could speak to this more than I can, after maybe 2 or 3 nights, a lot of times they become more stable. And I know on the floor at my hospital, I'm not sure about the ICU so much because it's a little different. When they're more stable on the floor, I know the third floor and the second floor are trying to do bundle care to decrease the amount of time you're in that room to let that patient rest. Do you remember that conversation, Ishmael? So if you want to elaborate on that, I think this is really good for our audience to hear that.
Yeah, so again, I'm not a physician. This is strictly my own data. There's no scientific process behind any of this. Every single patient that I have received, and I'm a day shift nurse, so I see this. I get to the hospital at 6:45 a.m. and I start shift change. And if I see a patient awake at that time, usually they're going to be in a very lousy mood. And then patients with brain injuries are also going to be in worse shape as far as their cognitive abilities versus the patients that sleep in that instead of waking up at 7:30 in the morning or 7 a.m. when nurses have to do their shift change, if we quietly introduce ourselves and quietly allow the patient to return to sleep. This is obviously with patients that are not uh, critically ill, that need to have neurological assessments that require the patient's full attention and require the light on. But if there's a patient that is not as severe, for example, we have a patient that's really at a medical level, so they're okay to sleep. They don't have to be interacting with the nurse. They're not there for neurological problems. If you allow them to sleep, man, that patient just wakes up in a completely different realm altogether. They are calmer, their minds are more capable of processing a hospitalization. Their minds are not on edge with pain or worries or anxiety. You could just see a tremendous difference on the status of a patient when they have had a good night of sleep versus not a good night of sleep. And then even I've even noticed, and again, this is completely subjective data. This is just my own observations. If I have a patient that has had neurological issues, if they get a good stretch of 4 hours of sleep, um, when they haven't slept at all, they wake up like sometimes they'll start talking when they weren't able to talk, and everybody's amazed, like, what happened? This patient couldn't speak 4 hours ago, and now the patient is speaking in coherent sentences. It's, the word salad is instead of 50% of the words, something like 10 or 15% of the words are in the word salad. So for patients in the hospital, sleep is just imperative. And like Kelly said, for good outcomes, I think sleep is this again. This is my opinion. Nothing professionally said in this realm, but I think sleep is just as good as meds because it really shapes the recovery of the patient. I've had patients that have not slept well, and because I'm so keen and aware of this whole sleep issue, I allow as much privacy as I can provide, given my orders, of course, and the policies of the floor. I allow the patient to get as much quiet sleep as possible, and they are always telling me, "Man, I am so thankful I had you. I have not rested the whole week. This is the first time that I had a couple of hours of sleep and rest, and I feel so much better." And then just the outcome just improves. I could see it as a nurse. I've had doctors, unbeknownst to them, right, that they're like, "Wow, this patient's doing better today," and I'm just to myself, I'm like, "Yeah, because I got some sleep." Yeah.
I love it because whenever I see Ishmael, he's usually around where his rooms are, which is helpful because sometimes you can't always be around your rooms, and sometimes they're not even together. I notice in the IMCU, the new one. But I always ask him most of the time, "Hey, is it okay if I go in there?" Because I don't want to mess up their sleep either. So it's nice to be able to ask the nurse that. And I want to say thank you, Ishmael, to you and all the nurses that really you protect your patients. All of you guys do. I know we can't always let them sleep for different reasons, but I just love it. And just like Donnie said, and I've said before, not on this podcast, but when you hear once we say something as a sleep navigator, and then the cardiology team comes behind us, or the stroke team comes behind us, and then the bonus and the the cherry on top for me is when the nurse comes behind and says, "Hey, you need to, last night they said you were snoring," or the night shift nurse is like, "I saw you stop breathing," and they're putting oxygen on them and they're trying to explain to them, "I'm putting oxygen on you because you probably have sleep apnea," then they're more willing to get help. But if a lot of times if they just hear from me, they're not always necessarily willing to do that. It's stronger when we all stand together as one team and say that. So thank
I
you.
have gone, I've gone to the extent of, um, this is particularly more common with male patients, right? Because us guys were kind of like, yeah, leave me alone. Go mind your business. Go fly a kite. I want to get out of here. I'm done with this hospital. I have pulled up their, we have them on monitor, so I can show them, like, look at your heart, look at your pressure, look at your oxygen level, look at these vital signs, what you were doing while you thought you were getting rest, and now you are awake and your pressure is down, your oxygenation is improved, your heart rate is slower. Don't you think it should be backwards? Don't you think that you should be very relaxed while you sleep instead of looking like you're running a marathon or going for a jog? And that and I talk to them on a male level, like this is very serious. You need to really address this because this is gonna end up, you're gonna blow a head gasket somewhere where you're really gonna regret this problem. You're really, and I sorry, and I have told them you are more than welcome before you leave here to look into the other rooms discreetly. Sorry, and see the patients that have had strokes and see the outcome and ask yourself if that's what you really want, because you don't want to address this issue, and this issue is very, very, very serious. Again, I honestly think, not being a physician, not having any sort of claim to this, but just from my own observations, that sleep apnea is one of the um, widest reaching epidemics, health epidemics that we have, that are just it's not being addressed. It's not even in the radar of most. And I honestly think it may have something to do with the fact that there's not necessarily a huge, influx of money with sleep, fixing sleep apnea. But for human beings, I think good sleep, it is absolutely crucial. Yeah.
Yeah, I think it's we also got to be, I tell my patients, you got to be proactive. You got to be the one that's looking for out for your best health, the best outcomes. And a lot of times our patients, they don't want to take that responsibility because that means they have to do something about it. And I always want to let them know that, you have a choice, you do, but just understand the consequences of those choices. Like you said, you want to go into a room and see what a stroke can do, letting them see that outcome. Because sometimes people just don't think it's going to happen to them, or the most famous things I usually hear, especially from males, is, "I don't know it's happening and I don't wake up." Yeah, you go in the bathroom 4 times, I go back to sleep. It doesn't bother me, but being proactive as a patient is essential for all of us because, medical professionals are the worst patients. We're non-compliant. We don't want to do anything we're supposed to, and we know better. So it has been an honor. So we like to, but I don't want to keep you long. So Kelly always has a question to ask, one or two. And thank you so much. And what you just said at the end was, I said, this is the way to end right there. That was amazing. So
Thank
thank
you.
you for sharing your insight.
Thank you for having me. Yeah.
Go ahead,
Yes,
Kelly.
and you ended it perfectly. I think it's
Did you?
great when a man talks to a man. We just had a new member of our team because we're all females, but we have a man now on our team that's in training. And Donnie said this too, and so is the other ladies. Sometimes men need to hear it from other men. So, because you have a different way perspective and how to present it. So, thank you. And anything you want to add before we go? Because I just totally enjoy this podcast. Thank you
Oh,
so
thank you.
much.
No, I feel like I've talked too much already.
It's
What
about
I
you.
Yeah, that's what I didn't say in the beginning. We do this for people that we want to honor. We do this for people who are making a difference in the community that sometimes may not be able to have the platform. So we want to invite people who are doing it real time and making a real difference. So know that that's what you're doing for us. And that's why you're here. That's thank you for honoring us and thank you for saying yes. We really
Yeah,
appreciate it.
I might add just one more thing. I wish there was a way to warn the greater health community at large of the seriousness of this problem, that it would be handled with the seriousness that it really requires, instead of, oh, they're just not oxygenating well. Then, yeah, they're gonna get, you know, heart failure, you know, left-sided heart failure when they turn 50 or 60. Oh yeah, they might have a stroke, they might not. Let's just put them on blood thinners, instead of preventing all of those catastrophes on a human being. Um, if we could, if the true, members of our healthcare community that have a real impact on these things, if good research can be put at the forefront of these physicians, so they can understand the severity of these issues, and they can really, the facilities can approach it in a very serious manner. I think it would just change the the health status of our entire country almost overnight, because there's a humongous percentage of us that just goes completely undiagnosed, unfortunately, I guess, untreated, and those are the unfortunate ones that end up with these horrendous issues.
Exactly.
Yeah, I love
All
it.
right, Kelly
And
G.
it takes a village to do that. And you included, Ishmael, all three of us are doing it. It takes us to speak out. So keep speaking out. You just doing it on the podcast. So great
Yeah.
job.
Yeah.
Thank you.
Thank
I'm
you,
going
guys.
to end this now. Stay on.
All right.